Let's talk about something no one wants to talk about, but most of us spend a lot of time thinking about it. I'm talking about cancer. Whether it's touched you personally, shown up in your family history, or quietly lives in the back of your mind as a thing that you hope never happens, it's something that we think about. And you probably have some questions you're too afraid to ask, like, what can I do to lower my risk? Is it true that this runs in families? If I beat it once, how do I make sure it doesn't come back? These are the questions that we're going to talk about today. Welcome to the Medical Disruptor, a place where well-versed women can ask the hard questions and get evidence-based answers that you won't find anywhere else. Our community is always informed, empowered, and science-backed. I'm Dr. E, the NP with a PhD, and I help smart, well-versed women go from medically gaslit to medically empowered. Solo episodes like this one is when I dig into one issue in depth, and then the guest episodes are where I sit down with clinicians who expand past their training. Today, we're talking about cancer. Here to give you some answers without fear-mongering and without the medical gaslighting that often comes when you ask these questions. Because here's what happens in most medical encounters when you bring up cancer prevention beyond the basics. Sure, your doctor will tell you not to smoke, get your mammograms, but when you ask about specific dietary strategies or stress management protocols or environmental toxin reduction, the conversation falls flat. You might hear, just eat healthy and exercise as generic advice. But when you ask for specifics, should I try intermittent fasting? What about reducing inflammatory foods? How do you address chronic stress that might affect your immune system? You're often told, no, there's not enough evidence on this, or it doesn't significantly impact risk. The conversation quickly shifts back to screening schedules and family history, leaving you with the impression that beyond avoiding obvious carcinogens like tobacco and alcohol, cancer prevention is largely out of your hands. It is what it is. And this response reveals something important about medical training. Physicians are amazing at identifying and treating established diseases, but they often lack the training in the nuanced lifestyle factors that influence cancer development. When you ask about optimizing cellular function or addressing subclinical inflammation, many providers simply don't have the clinical framework to give you detailed answers. But here's what the research shows, because we are science-backed. Up to 70% of cancers are linked to lifestyle and environmental factors. 70%. That means that there are things that you can absolutely influence to help reduce the risk of cancer. The World Cancer Research Fund has documented that diet, physical activity, body composition, environmental exposures significantly affect cancer development and progression. This information rarely makes it into a standard cancer prevention discussion. Instead, you're told it's genetic, bad luck, which leaves you feeling powerless and uninformed about the potential control that you actually have. Because we want to have control wherever we can. Of course, some things are out of our control, but to say that it's just bad luck is really not empowering. Today, we're going to do a deep dive on the peer-reviewed science on the 4 most significant modifiable risk factors. Modifiable means you have control, you have ownership. Chronic stress and immune dysfunction, sedentary lifestyle and metabolic dysregulation, inflammatory nutrition patterns, and environmental toxin exposure. Let's explore how the cellular mechanisms that can really affect cancer development and give some concrete evidence-based strategies to reduce your risk. Because you deserve more than fear, which some influencers will just give you, and false reassurance, where sometimes you get in the medical community. You deserve the scientific knowledge to take an active role in your own cancer prevention. Now, remember, this is all about reducing risk. I'm not saying that we guarantee never to get cancer. I'm not saying we can reverse your cancer, okay? We are science-backed here in this community. We're talking about reducing risk. And I want to give you a story that happens a lot in my practice. Let's just say the patient's name is Michelle, but it could be any patient because I hear this over and over again, who comes back for a primary care follow-up after completing breast cancer treatment. And during her follow-up visits with oncology, she's really good. She does all the things. She consistently asks, what can she change in her diet or her stress or her supplements to help reduce the recurrence risk? And each time she's told there is not enough strong evidence that any of these things will make a difference. And that as long as her tumor markers are undetectable, there's nothing more she needs to do except show up for the surveillance scans. Now, if you know anyone or if you've been through cancer, you know that feeling of just like in between the scans, in between the surveillance follow-up, is like this horrible feeling of foreboding and horrible feeling of lack of control or power. And to tell people that there's absolutely nothing to do in between the scans, I don't know. It doesn't make sense to me. And Michelle left these appointments feeling frustrated and powerless because she understood intuitively that there's got to be some connection between her body's environment and, the fact that her body allowed cancer to develop in the first place. And she wanted to do the most that she could to change the environment in her body to help prevent recurrence. Again, there's no guarantees, but to do nothing to try to help prevent your own recurrence didn't make sense. And her medical team had no framework for addressing this. Because remember, we discussed in our Food is Medicine episode that nutrition is not something that's taught in med school. And I'm not here to bash doctors. I love the doctors. Some of my best friends are doctors. I'm an NP. My wife's a PA. We live in conventional medicine. This is not about bashing people, right? The medical education undoubtedly saved my patient's life. It helped her successfully eliminate her cancer. There's no question. The diagnostic skills, the surgical expertise, the treatment protocols that oncologists master are absolutely life-saving and essential. I'm not taking away from that. And I want to be clear here. We will never bash doctors here. We're always going to say, though, yes, and there is more that we can do. That is not enough. Medical education focused heavily on diagnosis and treatment of established disease. But we know that the average medical school curriculum dedicates minimal time to nutrition, environmental medicine, or some of the other things we talk about here. Physicians learn to recognize and treat cancer brilliantly, but they're not trained in the lifestyle factors that influence cancer development or recurrence. And this creates a bit of a blind spot where patients are seeking evidence-based strategies, but are often being dismissed, telling them that their concerns are not medically relevant. And again, it's not that physicians don't care. It's that they weren't trained to think about health optimization from this perspective. They just weren't trained to think about it this way. And that's okay. The research reality is that the American Institute of Cancer Research estimates that approximately 40% of cancer cases in the US could be prevented through lifestyle modification. The World Health Organization puts this number higher at 50 to 70% globally. Yet this information rarely translates into clinical practice because prevention doesn't fit into a disease-focused model. It's more about screening and finding and treating. So let's talk about the number one thing that can affect chronic stress. Chronic stress is a hard one because we're all stressed and it feels kind of woo-woo to talk about it. But chronic stress, we talked about it in dementia. You could check that episode out where it really physically changes your brain structure. But chronic stress is not just about feeling overwhelmed. It creates measurable biological changes that affect and influence the potential increased risk for cancer development and progression. Some of my patients will come in and say, after they got diagnosed with cancer, and some of them will tell me, prior to the diagnosis was some of the most stressful time of their life. They went through a crazy divorce or bankruptcy. Something really intense happened right before their diagnosis. And they often ask, could the stress have been a contributor to cancer? And not that you're going to blame yourself for it, but when we look back, we want to see what are the things that affected us or got us here. And there is a stress-cancer connection. I'm not saying that everyone who's stressed has cancer. And I'm not saying that everyone who has cancer has stress. Remember, we're talking about reducing risk. There is a stress-cancer connection. So now acute stress can actually help immune system if it's like a quick acute stress, but chronic stress actually creates immunosuppression. It suppresses our immune system through several ways. Cortisol and immune function. Chronic stress elevates cortisol. Cortisol suppresses something called NK, natural killer cell activity. NK cells are your immune system's frontline defense against cancer. They constantly patrol your body and destroy abnormal cells. And cortisol suppresses this activity. Research published in Brain Behavior and Immunity found that women with chronically elevated cortisol had 40% lower NK cell activity compared to women with healthy stress responses. This suppression can persist for months after the stressful period ends. Okay, so that's just one way where stress can affect your body's response or internal surveillance of cancer. Inflammatory cytokines is another way. Chronic stress triggers the release of pro-inflammatory cytokines. IL-6, TNF-alpha, IL-1 beta, who cares what the names are? These inflammatory mediators create an environment that supports tumor growth and metastasis. Then there's something called the neuroepinephrine pathway, which is probably the most concerning. Chronic stress releases constant neuroepinephrine, which directly stimulates cancer cell proliferation. A 2019 study in cancer research showed that neuroepi could increase breast cancer cell growth by 300% in laboratory conditions. a landmark Swedish study found that those who experienced severe life stressors had a 62% increased risk of developing breast cancer compared to women with lower stress exposure. And for people who already have cancer, chronic stress significantly worsens outcomes. The 2020 meta-analysis of 15 studies found that cancer patients with high stress levels had shorter survival times and higher recurrence rates across multiple cancer types. So when people ask, can stress affect whether or not I got cancer, or whether or not it's going to come back, it's clear to see the data is there. Chronic stress from caregiving, work pressure, relationship issues can create immune suppression at exactly the time when your body needs it most. So when we're talking about intervention, without question, we need all the conventional medicine stuff. There's no question if we need surgery, chemo, or radiation, whatever's recommended, it's never instead of. But in addition to, what would it look like if part of the interventions was also to discuss stress reduction? So adding supportive strategies to enhance, not replace, proven medical care can really make a difference with everything, but certainly with cancer. All right, quick pause. If this episode is hitting home, check out the Medical Disruptor merch. It's not just a shirt, it's a statement, and every piece helps spread the message. You can find it on my website, drefratlamondre.com. Now, back to the episode. Okay, that was stress. Let's move on to the second one, which is physical activity and metabolic health. The relationship between physical activity and cancer prevention is one of these things that there is so much evidence on, yet it's often treated as like this peripheral recommendation, like it's not really important. And there's so much evidence about this. 2016 analysis published in JAMA Internal Medicine examined data and found that physical activity significantly reduced the risk of 13 different types of cancer: breast, colon, lung, liver. And what makes this research particularly compelling is that these protective effects were independent of body weight, meaning exercise provided cancer protection regardless of healthy weight. Just exercising wasn't about losing weight. It's just moving reduced cancer risk. And how does it work? It works kind of similarly to stress. When you move, you increase that NK cell activity, that what I told you about, that is constantly surveying and making sure there's no cancer. A single bout of moderate exercise can increase circulating NK cells by 50 to 300% for several hours. Regular exercising training means that you're constantly going to have sustained improvement. If one bout of moderate exercise increases circulation, imagine if you do it every day. So that's the first way. The second way is when you move, you are regulated. Your hormones are regulated. It helps regulate insulin. It helps regulate sex hormones, all of which plays a role in cancer. Also, when you exercise, you reduce inflammation. Regular exercise reduces chronic inflammation. And when we reduce inflammation, it creates a better cellular environment, less conducive to cancer. When you exercise, you're also more inclined to do what's called DNA repair and to release antioxidant enzymes. And all of that protects against cancer. So when my patient comes in, a breast cancer survivor, and gave me 2 years post-treatment, and she's really been searching for things that she can do. And one of the things that she mentioned is that she's not been moving. She's sedentary for most of her adult life, and she was really terrified of recurrence. So we started implementing 20 minutes of walking a day. Just 20 minutes of walking a day. Didn't need a gym membership, just your regular sneakers. Go outside for 20 minutes a day. And eventually she started adding, more things, strength training and high intensity workouts. But 20 minutes a day is when we started. And Sarah's inflammatory markers dropped significantly and her insulin sensitivity improved. Now we know that that's what happens with exercise. And I can't claim that that is necessarily the only thing that prevented her recurrence. But we know that her inflammation substantially reduced just by adding this exercise. And cancer is complex, and I'm not going to simplify it by saying because she exercised, she didn't get it back. There's so many factors here, but we undoubtedly reduced her systemic inflammation and undoubtedly reduced the risk of recurrence. It's all about reducing risk. And this is not just one patient story. There is so much data here. For cancer survivors, exercise research is so compelling. The Women's Healthy Eating Living study found that breast cancer survivors who engaged in regular physical activity had a 35 to 40% reduction in recurrence risk compared to those survivors who did not move. For colorectal cancer survivors, a 2018 study in the Journal of Clinical Oncology found that those who exercised regularly had a 42% lower risk of cancer-specific mortality. Just by moving, we are reducing recurrence. So we talk about stress and we talked about movement. let's talk a little bit about nutrition, inflammatory nutrition. And I just did a whole episode about food is medicine. Go ahead and find that if you can. But you should know, even if you don't watch that episode, what you need to get about that is that your food is code. It breaks down into code and it's giving your body constant information of what to do. Your body is constantly producing abnormal cells that could potentially become cancerous. That's just normal. It happens all the time. But whether these cells develop into actual cancer depends on the environment that you create, and part of that environment has to do with your dietary choices. Now, a really simple one is the sugar-cancer connection. Sometimes my colleagues roll their eye on this because it seems too basic, like sugar-cancer connection. Like what do we mean by that? But here's the thing. Cancer cells consume glucose. They consume it faster than normal cells. Okay, it's something called the Warburg effect. This isn't just interesting biology. This has implication. It means that high sugar diets can affect and stimulate cancer cells. The European Prospective Investigation into Cancer Nutrition, EPIC study, followed people and discovered that high glycemic index diets increased overall cancer risk by 15%, especially for breast, colorectal, and endometrial cancer. So am I saying that every single time you eat ice cream, you're increasing your risk of cancer? No. But I'm saying that if you have a diet that's high in sugar and you have high glycemic index, you're insulin resistant, you're pre-diabetes, you are creating an environment that will increase your risk of cancer. Really important that you hear what I'm saying. I don't want to oversimplify it. I think that's where we get this like medicine versus influencer mentality. And this space is about creating a space where you can ask questions and get answers in a way that's science-backed without it being hyperbole, like don't add sugar to your tea, you're going to get cancer, but also not being dismissive and saying, oh no, it doesn't matter how much sugar you eat. It doesn't increase the risk of cancer. It does. When we're talking about nutrition, it's not just sugar. There is also an obesity cancer link. The American Society of Clinical Oncology projects that obesity will soon overtake smoking as the leading preventable cause of cancer. Hear what I'm saying. The American Society of Oncology, that's the people who know cancer, project that obesity will soon overtake smoking as the leading preventable cause of cancer. This is not just about physical weight. It's about the inflammation and hormonal environment that exists when you have excess adipose tissue, when you have excess fat tissue. Fat tissue is not neutral. It's not just, okay, there's fat tissue here. Fat tissue produces inflammation, inflammatory cytokines. It also does some other things with estrogen production and can really promote tumor growth and the environment that is conducive to cancer. On the flip side, anti-inflammatory nutrition that's rich in omega-3 acids, rich in polyphenols, that's the things that make your vegetables and your fruit the colors that they are, diverse plant compounds, create a cellular environment that's hostile to cancer development. So it's not just about removing that stuff, which can reduce the environment that can create cancer, but adding the anti-inflammatory nutrition can create an environment that's hostile to cancer development. You can go on the offense by eating anti-inflammatory nutrition instead of just being on the defense. While we're going on the offense, there's also specific compounds that you can add that are known to help create an environment that's hostile to cancer. Cruciferous vegetables, which has sulforaphane in it. Berries, which has the things that turn their color, those phytonutrients, are also anti-cancer. Green tea can all help prevent cancer. Remember, I did not say these things are going to cure cancer. I am just talking about reducing the risk, creating a hostile environment for it to grow. There's even research about intermittent fasting and cancer. There's emerging research that this time-restricting eating can create a cancer prevention benefits. All of this is to say that you can use your nutrition to either create an environment that is very welcoming to cancer, or you can create an environment that is hostile to cancer. The choice is yours. Okay, we talked about nutrition, we talked about stress, we talked about movement. Last on our list is environmental toxins and how they affect cancer. And this is perhaps the most overlooked aspect of cancer prevention in conventional medicine, the role of environmental toxin exposure in the development of cancer. Because what we're exposed to over time can create an environment or increase our risk for cancer. The exposure reality, we live with an unprecedented chemical exposure. The CDC's National Health and Nutrition Examination Survey regularly detects hundreds of synthetic chemicals in human blood and urine samples, including pesticides, plastics, flame retardants, and heavy metals. And many of these compounds are known or suspected carcinogens. Now, I'm not saying that you can get rid of them all or any of them, but we need to understand their effects and we need to minimize our exposure. There are some chemicals that are called endocrine disrupting chemicals. These are compounds that interfere with how your hormones behave in your body. And since some cancers are hormone sensitive, like breast, prostate, endometrial cancer, knowing if you're exposed to endocrine disrupting chemicals is really important. And some of them are really common. Bisphenol A, BPA, is found in plastic. And this particular chemical mimics estrogen and stimulates estrogen positive cancer cells. Parabens in our makeup and in our creams can accumulate in breast tissue and have been detected in breast cancer tumors at concentrations higher than the surrounding tissue. Pesticide exposure has been linked to multiple cancer types. So that means women living in agricultural areas had higher rates of hormone-sensitive cancers, even when they weren't directly involved in farming, suggesting that the environmental drift and food residue exposure contribute to cancer risk. Now, it's true, we are all constantly exposed to it, and not all of us have cancer. That's true, because a lot of times that's what doctors say. Well, if that was the case, we'd all have cancer. But your body can only eliminate so much, right? We do have the ability to eliminate a lot of toxins, but if we're constantly exposed to it, then there is a buildup. And not everyone has the same genes. Some people are genetically less inclined to be able to detoxify. Some people genetically have a harder time of eliminating some of the things they're exposed to. We worked with a patient who developed bladder cancer at age 45 with no family history and no obvious risk factors. And we investigated her environmental exposures. We discovered that she was working in a building with known water damage and mold contamination for 8 years. She was working in this environment. Now, again, that doesn't mean that every mold is bad, and it doesn't mean that everyone who's exposed to mold is getting cancer. But for some people who are exposed to it for 8 years on a daily basis, and maybe with her particular genetic makeup, she was unable to detoxify from that. And this is really important because that means that not only did she need her cancer treatment, which she did, because we are always for the treatment, but in addition to that, by recognizing the mold exposure, we also implemented detoxification support to get rid of that mold, and she changed her workplace, right? So in addition to being cancer-free, her energy improved, her immune markers strengthened, and she still remains cancer-free till this day. Now, I am not saying that it's just because of the mold, but why not also manage that? Why are we boxing ourselves into just removing the cancer and then insisting that nothing else is part of it, right? It just doesn't make sense. And as I said, we are constantly exposed to toxins, and I'm not asking you to get crazy over it and, get nervous over it. But you could just make some simple changes that can reduce some exposure that we have control over. Using glass instead of plastic is really important, especially if you're going to microwave, right? Choosing organic produce when you can, filtering your drinking water, selecting personal care products that are free from certain chemicals. You don't have to do all of it, and you don't have to do it all at once. Just choose one or two things that is in your daily exposure and consider changing it. So here's your aha moment. This is the takeaway moment that I want you to get from this episode, because I gave a lot of studies and I gave a lot of information. What I want you to know is that cancer prevention is not just about genetics or luck. And it's not just about screenings. Of course, you should get your screenings. But it's about understanding how we can create an environment in our body that is either hostile to cancer or welcoming to cancer. Now, again, that doesn't mean you caused your own cancer. And it doesn't mean you can cure your cancer. Please, for goodness sakes, do not take my sentences out of context. I'm just talking about the things that we could do to reduce our risk of getting cancer. And for those of us who had cancer, reducing the risk of it coming back. It's really important that we understand, because the research shows that lifestyle and environmental factors influence cancer. Yet this information is rarely translated into practical, preventable strategies in conventional medicine. So when you ask your healthcare provider about diet, stress management, or environmental factors, and you ask them, does this play a role in cancer prevention? And if they're told, no, not really, then what you're encountering is not that they're trying to gaslight you, maliciously. What you're encountering is a limitation of their training. It's not a limitation of the evidence. It's not a limitation of the data. It's not a limitation of the science. It's a limitation of their training. They have not been trained about the lifestyle modifications and the nutritional modifications that can contribute to cancer. So trust your instinct to address these factors because it is proven by research. You're not being overly cautious or you're not falling for unproven theories. Your body has an ability to help reduce the risk of cancer. And it depends on maintaining optimal immune surveillance, reducing the inflammation, and reducing your toxic load. And the best part about it is that these are areas where you can have significant control, significant ownership of what's happening in your body. Your immediate next steps. What do we do with all that information? I got it. I got the aha moment. There's things that I can do. I'm not just going to sit passively by. Your immediate next steps, always choose one thing that you have room for improvement, right? Don't do everything. It's too crazy to do everything. It's never ending. It's overwhelming. Choose one thing. If you're chronically stressed, prioritize stress. If your diet is high in processed sugars, prioritize that. If you feel that you're really around a lot of toxins, prioritize that. Second, if we're talking about environmental toxins, just do simple swaps. Don't go crazy. Don't replace your whole house, okay? Just maybe start with your cleaning products, replace them for something else, or choose the organic version of the most pesticide-heavy fruits and vegetables. Switch to glass food storage instead of those plastic containers. Just make a small swap. Again, don't get overwhelmed. The third is implement movement as medicine, not just exercise. It's not about joining the gym. It's not about spending money on a cute outfit. And it's not about losing weight. It's about finding physical activities that you can enjoy and do long-term, because the goal is consistency over intensity. I don't need you to do one crazy workout one weekend a month and never do anything else again, right? Consistency over intensity. Regular, moderate activity provides more cancer protection than sporadic, intense workouts. And last, you can do this on your own. There is so much information out there to do this on their own. But if you want to find a guide that understands the integrative cancer prevention, that there are so many things that you could do with your life to help prevent it. Now, that does not mean to get rid of your primary care provider. You still need your PCP. They are only one part of your entire health team. Remember, you don't have to wait for a diagnosis to start protecting yourself. And you don't have to accept that cancer is just a genetic destiny. And you don't have to choose between conventional medicine care and lifestyle interventions. The most effective approach combines both. It is not either or. It's yes and. You have more control over your cancer risk than you've been told. Use that knowledge to take action starting today. And with that, we've come to the end of another episode of the Medical Disruptor. You're now part of a community that doesn't exist anywhere else. A safe space for women who want real scientific information, but also want to ask questions without being made to feel crazy. Our community is informed, empowered, and science-backed. Ready to go deeper? Go on my website, drafratlamandre.com. That has my book, PDFs, newsletter, and a link for a consult. Until then, keep asking questions, keep asking for more, and keep disrupting.